I had a wonderful pediatrician growing up who really showed me that you can treat patients like family and really get them to kind of commit to their care longitudinally. Family medicine was kind of that, but graduated to all spans of life, you know, from newborns to elder cares. And so it was a really interesting field to me. I'm interested in preventative medicine. But primarily it was like the relationships with patients that drove me to family medicine. We have the most continuity of care. You know, we're the primary care team. So you get to see people for years. We're always the home base, you know, between hospital stays, between other appointments, and we kind of help direct your care. We help explain things to you. We help advocate for you. I try my best to partner with my patients and come up with a shared decision for their care. I never want people to feel like I'm coming and telling them what they have to do. I try to explain what's going on. I try to go over labs with them or disease states with them and talk to them about options as far as medication and treatments and things and help us make a plan together. We do a lot of our wellness and preventative visits, so we try to cover all of the preventative care that we can, as well as, you know, chronic disease management. I also offer a lot of like contraceptive management, so, you know, that's an area of interest for me for our younger patients to help and different types of procedures and things like that. We coordinate a lot of care in the background with specialists. If I ever have a question, I'm not afraid to send a message to a patient's cardiologist or nephrologist and kind of get their input on their care and what we should do moving forward. And then vice versa. You know, I think a lot of our specialists do a great job at reaching out to us if they need something. I grew up here where I practice, which is a really cool and unique thing. And so some of the patients, you know, I've also known outside of, you know, healthcare in my life, and then some of them I've just gotten to know over the past several years. And so building that relationship and having somebody trust you to make decisions about their health is such a privilege and an honor. Outside of the hospital, I enjoy spending time with my family. I enjoy the parks. I have a dog, so I like to cook. So those are all things that are important to me.